Well, good morning, everybody.
Good morning.
Welcome to our transportation conference. I'm Dale Berry, and along with Marie Press, who is managing the virtual portion of this conference. We are the co-chairs of the Healthy Aging Collaborative, which is an initiative of the Washtenaw initiative with WHI. The Health Initiative, WHI, was formed 13 years ago in partnership with the University of Michigan Hospital, Trinity Health St. Joe's Health System, CHART, the Center for Health and Research Transformation, serves as their facilitator. The WHI was initially designed to address the impact of the new Affordable Care Act and how our county and our community should respond to that. The WHI initially prioritized primary care, care navigation, dental care, Medicaid enrollment, mental health, and substance abuse in its work plan. 13,000 residents at the time were enrolled in Medicaid insurance plans by WHI volunteers. And the organization's had many successes, but there is so much more work to do. This, I think we all know. The organization is focusing on reduction of opioid use, homelessness, race equity, care coordination, healthy aging, and social isolation. These are just a few of the areas that the WHI is working on. The founders also began a successful relationship with CHART, the Center for Health Research and the Center for Health and Research Transformation at the University of Michigan. CHART continues to provide backbone support for WHI, and they help keep our collaborative organized connected as we work on transformative projects in Washtenaw County. I'd like to recognize Dina Smith, Aaron Horn, and Allison Fritsch for their hard work and leadership and dedication to the WHI in so many areas. Thank you. In 2021, that's about 2 years ago, the WHI and the Area Commission on Aging 1B launched the Healthy Aging Collaborative, with representatives from 12 different domains. I think the domains are in the brochure that you have in front of you, and they have them up on the screen. To examine and find solutions to many of the gaps that seniors and caregivers deal with. Transportation is one of those gaps, and the lack of transportation is a major contributor to social isolation and older adults. That's why we're here today. As people age, their healthcare needs grow and their mobility declines. My mother, who lived to the age of 97, is an example that I watched firsthand. She and my father thrived in their home until they were in their 80s. She was 84 when my dad passed away, and she continued to drive until she was about 90. That's when we discovered that she was taking daily Darvocet, a narcotic for pain in her hip. And we said, Mom, I don't think that's a good idea that you're driving and you're on Darvocet every day. And her answer was, well, I'm a pretty good driver. Well, people on narcotics probably shouldn't judge their own driving. By 90, my mom's friends had passed away, and our family stepped up to help her. She was fortunate to be able to move to a retirement community, but it was still necessary for her to go to the doctor, for primary care, to the dentist, and visit the store. Then her mobility reduced to the point that she needed a wheelchair, and at the same time, she began showing cognitive difficulties. Wheelchair van transportation in her community was not always helpful or reliable, and it was costly. Availability was limited, And again, because of her cognitive decline, she just couldn't deal with it. Again, family stepped in to help. Well, my mom was fortunate. She was married for 65 years, and she and my dad helped each other as they got older. But what about people in our community that don't have as much to help each other? For a while, my mom had a car, but a lot of people don't have cars. What about people that don't have a car? And she had family willing to help, but some people just don't have family members nearby. The older one gets, friends disappear, transportation needs grow, and one's cognitive ability to deal with it complicates everything. That is what we're here to talk about, all of this today. The Healthy Aging Collaborative began looking into the issue as our first deep dive into the top areas of concern facing seniors today. We have a wonderful, high-quality transit system in Washtenaw County. We sit right there. And several nonprofit organizations that provide transportation in the outlying areas. We are thankful and supportive of these organizations. But we have gaps. In particular, we heard from healthcare organizations that said that it was difficult to arrange transportation for seniors for clinic visits and a return home, especially for people that need door-through-door service. You're going to hear a little bit about door-to-door service and door-through-door service. That's for people who are frail and they actually need someone to go in and help them get outside. We'll hear more about that today. And the providers we talked to said early on said it's a growing problem in Washtenaw County. Last, I would like to recognize the Arbor Community Foundation. Chris Levin. Chris, thank you. Our community foundation provided the funding for Ann Savas and the University of Michigan to help our group analyze these gaps. They also provided funding for our summit today. Please join me in thanking Chris and the foundation for being here. Housekeeping things, we will have table discussion period after each speaker at your table. Please designate one of your table mates who can speak to be the reporter back to the larger group. There should be designated note takers at each table, but if you don't have a note taker, perhaps you can commandeer somebody to write your thoughts down. Please hold your questions for speakers till the end of the summit. There will be time for questions and additional networking. And while there are no set time for breaks, you're welcome to take breaks during the report out time or whenever you need to. The bathrooms are located in the hallway just outside, and the food and drinks will be available throughout the morning. Thank you. The first speaker I would like to introduce is Ann Savas. The Healthy Aging Collaborative engaged Ann, who is a clinical faculty member at the University of Michigan Department of Social Work. She and her students helped us examine the current transportation situation. I'm going to pass the microphone off to Ann to talk about some of the groundwork she's been doing in the current state of transportation, the landscape for seniors in the county.
Thank you very much. Yeah. I have 10 minutes to provide you with an overview of what we found in the last 10 months. I do want to begin by saying we approached the project, the review of the transportation system for older adults using an assets frame. We wanted to begin with what's going well for whom, right? What do we have in place that's working? So what I'm going to present to you today is the work of our committee. It wasn't just me, I was just sort of shepherding the process, but it was all of us. And we were really working toward finding better ways. So first I want to start by just listing out the data collection sources and methods. We started with publicly available reports. We tried to find data, we'll get at that in a minute. We developed an inventory of all the local transportation providers, conducted interviews with key stakeholders. I think what was most exciting was the implementation of our secret shopper experiment. So we basically made calls to providers and asked for routes, and we said, hey, my mom is in a wheelchair, she's trying to get from point A to point B, can we get a ride at this time of day, how much is the cost? Can you come and help her get into the vehicle? We learned quite a bit from that. We contacted 28 providers, but we made probably 2 to 3 calls for each provider. I'll tell you a little bit more about that in a minute. We also had some ideas about improving the system. So I met with some older adults and used a user experience interview method to find out if these ideas were useful or fruitful for them. We also looked at financial reports with little success and a few 99s as well. So just as Dale mentioned, we have some great if-then statements about older adults. If they have transportation, we know they're more likely to be able to access good services, social networks. We'll see improved quality of life, health, and well-being. And then there's the other if-then statement, the folks that can't access transportation and what happens with them. In our discovery, I found 2 really great questions that Michigan Medicine uses with all of our patients. It's 2 transportation questions about social determinants of health. Oh, the problem was we couldn't find the data. So as we were making our way through the project, one thing we did learn is that we have really good data on fruit and veggie intake for our older adults, which is going to be helpful for a lot of our food providers, but we have very little data on transportation. So that's something that we need to solve. We don't have good data on the need for routes. We don't have good data on the accommodations that are needed. We don't have good data on what's working for whom. So how might we improve equitable access to transportation? And we started using this design thinking frame with our work. We really wanted to move the conversation of understanding the system towards solutions, towards innovations, right? Towards improvements. So you'll see this question syntax used throughout my slides. We learned very quickly who's more likely to get a ride. If you look at this list, you'll see you need to be living in a high density area. You need to live on a public transportation route. If you're lucky, you belong to a senior center that offers rides, that has a van, that you can get in and out of your home on your own, right? That you have a smartphone. We found that the best way to find rides is to do it right with an app, to do it online. So folks that are still using sort of the flip phone without the smart capacity are really struggling to find to even find the transportation provider. So in our secret shopper experiment, we asked the question, so what other transportation provider in the county can help us get from point A to point B? So let's say we make a call, we ask a provider in Saline how to get to the right medical center. They say, that's not our route. And we say, oh, okay, who else do you know that could help us? And they say, we don't know. I'm a dispatcher, I don't know. Who else could I call? I'm not sure. So then it's a dead end, right? As an older adult, and you've got to pick up the phone, find another provider, and keep moving. What we did learn is that older adults have a network, sort of a shared, I call it the sticky system, a network of really sharing the providers that they are using and the providers that have worked for them. And so I was able to find a whole bunch of sticky notes, like up on bulletin boards in senior centers and up on bulletin boards in residential communities where people had found a ride and they left it for somebody else saying, hey, call this person if you need a ride. And so we began to explore the idea of a mobility manager. What would a transportation navigator look like if we brought in that kind of a service into our community? Could help our older adults find the provider, communicate the routes and schedules, calculate the cost, am I eligible for a discount? Even how to pay for the ride, that's a big question now for older adults. Do I need cash? How do I pay for the ride? Finding providers that can accommodate their wheelchair, their walker, right? Getting them in and out of the door, this door to door or the door through service. So we found that we also learned that there is a spending allocation for mobility managers in our county. And the question for us today is, how are those funds being spent? If our secret shoppers weren't able to find the rides from point A to point B, where is the mobility manager money sitting, and how could we maybe rethink, right, or reuse that? This is a picture of the Rome bus out of the Chelsea Senior Center. This was a collaboration between the Ann Arbor Area Community Foundation, starting with the Vital Senior Initiative, and then the center working very closely with WAVE to bring a vehicle into the community. And one of the questions we have is, how might we bring additional vehicles into the county? Do we need local funding first? Is there public funding available? What if we need a replacement vehicle? A lot of questions about operational costs. I asked the senior center director just a minute ago while we were getting bagels, if we could get you a vehicle, we could find you operational costs, we could pay for your driver a fair wage. Would you be interested in offering and bringing a vehicle into the senior center to provide rides for your members? Absolutely. So there is an interest. There are other senior centers and other groups that support seniors that would be interested in a vehicle. The challenge is, how do we bring those vehicles in? The next question we were really interested in is thinking about the authority, our transportation authority. One of the things that we learned about is our current authority, the AATA, covers Ann Arbor, Feonix Township. There's a lot of public transportation, a lot of routes, those are high density areas. But we were wondering about expanding the coverage or creating a new authority, and we didn't really know much about this, so we got interested in it. We talked to Jen from MDOT and a couple other folks, and we learned there's a Michigan Public Act 196. So we grabbed the policy and we learned that you can, in our county, we could create an additional authority, or we could expand the coverage of the authority we have. We have to have approval from our local government, the municipalities, our board of commissioners, of course. But just the idea that we could change this was just right hopeful. We were thinking, wow, it's an opportunity. Maybe we can sort of look carefully at where we have coverage and where we could potentially expand coverage. I mean, maybe it means we have authority on the west side of the county, or we have authority on the east side of the county, right? But the idea is that we have more coverage and we have more coordination. So this was probably the most controversial piece of our work. I had suggested at one point learning more about the flow of money into the transportation system. Where is the money coming from and where is the money going? This is a sample of something called a Sankey diagram. It's specifically used to map flow. So this is a DAR flow. This is the flow we were hoping to present to all of you today, but we failed. We failed in that it is very, very hard for us to track the flow of money. The way the Sankey works is you look on the left side and we have the inputs. So maybe we have what's coming from the feds that's being passed through. Where is the state contributing? Where is the county contributing, right? What are the foundations funding, grants? Are the hospital systems through community benefit dollars funding our transportation? So you have the input on the left, and then you track the flow of money using these paths into the providers that would be listed on the right. And so this was something we were hoping to do, but it was really hard for us to look at the financial statements, the 990s, and to track this. This is on my community service to-do list. So this is something I'm going to continue to work on. I think it's going to be really helpful for us to understand how the money is flowing. I did talk with one of our nonprofit providers and asked them about the money they were receiving, public dollars, and they were receiving $1,000. And so I said, well, that's pretty good, $1,000 a month. I mean, at least you could pay a part-time driver. And they said, no, it's $1,000 for the year. I said, whoa. All right, so hopefully you get a quick overview of what we did in the 10 months. We are so excited to learn more from our speakers today. So we've got 3 speakers coming up that will give us a real in-depth deep dive into some of the questions that I've raised. I also want to let you know there will be a full report coming, so we're working on that. But we were waiting to produce the report because we want your input today. So we're hoping through these table discussions, we'll be able to document your ideas and we'll roll those into our report. So again, thank you for coming. I'll pass it on to Dale.
Thank you, Sue Ann. Our first speaker, Sue Ann, you were a speaker. So our second speaker is Matt Carpenter. Matt has been Chief Executive Officer of the Ann Arbor Area Transportation Authority, the RIDE, since 2015. He came back to Ann Arbor from Sherwood Park, Alberta, which he described to me this morning as near the North Pole. But a town that had 1 million people there. And he was CEO of the Washtenaw County transit system when he was there. Prior to that, Matt worked for the Southeastern Michigan Council of Governments in Detroit, and he holds a Master of Urban Planning degree from the University of Michigan. Matt.
Well, I'm happy to be number 2 after Sue Ann. Hard act to follow. My name is Matt Carpenter. I'm the CEO of the Arbor Area Transportation Authority, sometimes referred to as the RIDE. I actually want to compliment the initiative on the work that they've done in understanding transportation and the background to it. The Sankey Club, give it time. I've been doing this over 20 years. And there are moments where I feel like I've almost got it. One of the most complicated pieces of plumbing in our society. So, what I'm going to talk about today is a little bit about the RIDE, but I'm going to try to focus my comments more on the issues that I know matter to you, services for seniors, and particularly outside of the sort of core urban area of Ann Arbor and Ypsilanti. Before I do, however, I do want to acknowledge a couple of folks in the audience. I just want to say hello and welcome to them and thank you. First of all, I want to welcome Congresswoman Debbie Dingell in the back. Good morning. Member Justin Hobb. Elected officials in the room. And I'm sorry, you are
Lynette, and we clerk for Charter Township.
Geissler. Welcome, thank you. You know, the people that we're going to talk about, they're really the core of what we're going to be talking about today, the people we want to serve, the lives that we want to protect. Well, what I'm going to be talking about a lot are going to be things that Sue Ann's already introduced, the political structures that we're dealing with in funding. That underpin the services that we're talking about. I also want to acknowledge a few other people in the room. Robert, where are you? Robert's one of my colleagues, Robert Williams here from the RIDE, Julia Roberts from the WAVE, Julia, another transit provider, and Doug Anderson from in the back. So you have a lot of transit agency personnel here in the room. So we're here to be a part of this conversation. So this is a complicated subject, and it's always changing. There's new technologies, new funding streams, and a lot of our fellow speakers here following me are going to have newer information than I do on all of these things. I'm going to speak to you from a very sort of traditional approach. How do the political structures work? How do the funding mechanisms come about? And then begin to continue building, I should say, the baseline that Sue Ann introduced. But I also want to say this at the beginning, thank you for your interest in this subject. Helping people access opportunities is what transportation providers like us do. Yes, we use buses, but really we're talking about getting people to opportunity, whether that's a medical appointment, a job, education, social activity. All those things matter, and I really want to thank you for your interest in this issue. So very quickly, a little bit about the RIDE. Legislative work. In Arbor, Ypsilanti Township, area. We provide service primarily for our fixed route. We have about 30 fixed route buses. You'll see many of them back and forth in our area here. We also provide a paratransit service called A Ride. We'll hear a bit about that. And we dabble in other things, carpooling, van pooling, that are primarily focused on the commuter market. We also have some other services. Detroit to Ann Arbor is a newer service in partnership with the Regional Transit Authority of Southeast Michigan. We appreciate their help, that you can take a bus from downtown Ann Arbor to the transit. So we're happy to have those services in there. So a couple of things to talk about from a transportation economics perspective. And the first, and you've heard it already, transportation is expensive. And in my 20-something years, I have yet to find a way around that fundamental fact. It is labor intensive and it is capital intensive. The old joke is it's 25% of every cost, and roughly it's true. So we've heard about the possibility of just getting a bus, and that's a start. A lot of smaller operators and volunteer situations will get that bus, be very excited about it, and then something breaks. How do you maintain it? How do you replace it after 7 years? Wears it out because rusting. These costs come again and again and again, and they, even if you can stand something up, sometimes it, maintaining it becomes a challenge. So what we tend to do in the public transit area is not focus particularly on one group or another. We don't have many services, we'll talk a little bit about it, they're just for seniors, because that means the seniors would have to bear the full cost. Notwithstanding grants, and there's a lot of that from the federal government and state government in particular. So the residual net costs, somebody's got to bear that. It's usually the rider. So we do what's called mainstream. We bring every group into the larger pool of travelers so we can spread that per passenger cost over as many people as possible. We don't want seniors bearing the full price of this bus route. So we designed the bus route to serve as many people as we can. That makes sense, right? Spread the costs over society. So I call this mainstreaming. We bring as many people into the mass transit services as we can. Not for seniors, not for students, not for commuters. We're trying to bring them all together. Economies of scale. That's how we handle that price issue. The more economies of scale you have, the better you can spread the prices. Some of the things Ann said about services function better in population dense areas. That's what's happening. That's the economics behind it. Rural areas with lower population densities and longer distances between trips are a fundamental economic challenge to this model. We pay our drivers per hour. Our fuel is concerned per mile. If you've got 10 houses in a block, great, there's a big market for me there. If it's one house every mile, the economics change. So in addition to our main services, we do have other things that are specific for the older adults market. We have a number of discounted fares that we provide, including for seniors. We have services called Gold Ride, specifically targeted for this particular market. We do something called Grocery Ride. There are a couple of large senior facilities, residential facilities in Ann Arbor, and I think another in Atlanta. We bring one of our big buses out once a week, take people up, take them to the Myers, wait in the parking lot while they do the grocery shopping, take them back. It's a very valuable sort of targeted service, but it's hard to do that for everybody, as you might imagine. And we also have a local advisory council, a group, a public body that we go to that has to have someone from the area agency on aging. I would stumble on that to help us understand the needs of the older adults in the community. So if you're interested in participating, I'd love to get you into the LAC, local advisory council, so we know. And we also do our paratransit service. Paratransit is important. Many of you have heard of paratransit or A-Ride. So in addition to our fixed route buses, we have smaller buses that go door to door for folks. That door to door service is very important because if you can't get to a bus stop, maybe there's no sidewalk, maybe you have a fall, maybe you can't walk the 2 or 3 or 4 blocks necessary to get there. A-Ride and services like it are there for you because they're demand response, door to door, will come to your house and pick you up. However, you have to be eligible for it. The eligibility is not based on age, based on ability. So if you have a disability that prohibits you from using a fixed route bus, a ride is there for you. Again, not targeted for seniors, but I think we understand that as people get older, they tend to have more mobility limitations. So that service doubles, frankly, as a senior service in many cases. The challenge is that all of our regular services are only available in the Ann Arbor area, Ypsilanti area, the space in between, and to a degree, the periphery around them. I was asked to speak, and I'll return to that in a moment. I was asked to speak a little bit about our recent millage. There were some questions about what is in there. And this, millage, taxes, warming you up for something here. Okay, so millages, first of all, we have a lot of information, and I'd love to bring it to Dale and everyone else, and we can distribute this maybe afterwards. A lot of information on our website about specifically what services are that we've provided historically and that we're going to be providing in the next couple of years. In August of 22, our Ann Arbor, Ypsi Township areas did approve an additional millage, and we are providing a number of additional services. We're going to have an express route that runs between downtown Ypsi and downtown Ann Arbor. We're going to take a 45-minute trip and get it down to half an hour. And that adds up over the years, over the days. We're going to have longer hours of operation all day, more frequent service on the weekends, and a variety of other things as well. So good stuff there. So some comments on countywide services for seniors. There are a lot of services already in Washtenaw County. We have the Wave, we have People's Express, and we have a lot of other smaller operations that you might call volunteer or charity models. They're operating in a hyper-local context, doing good in their community. When those are good, and as we've discovered, they do have some limitations, usually in terms of size and distance and how far they can get. And when your services are all concentrated on the far side of the county, this can be a limitation. One of the things, and Sue mentioned it, is mobility manager, which is an industry, well-established industry service process for stitching those various smaller operators together. You can think of it like a travel agent or a brokerage instead of a sticky note process, which I think is a good evocative description. You have one number you can call, and they can help you sort of pull that together. So that's an option. And it works in many places in many ways. However, it can only get you so far until you start to get into the areas of, do you have tax support? Do you have funding for a more robust system? So a couple of examples of how you can approach that issue. Up the road, up the highway of US 23 in Livingston County, they have a countywide door-to-door transportation called Livingston Essential Transportation Services, or LETS, LETS. My friend Greg runs it, does a very good job. That may be a model that you consider, the LETS model. The challenge there, if you know Livingston County, it's a kind of a low tax, low service jurisdiction. County Board of Commissioners allows it to operate, charters it, but does not give them any property taxes. So Greg's got to make this work based on state grants, federal grants, and rider's fares. So we can provide only so much service. Then you get into folks like the Ride and Wave, where I believe we have local tax support of one sort or another. Either it's coming from a municipality's general fund, or in our case, dedicated property tax villages that are specific to us. Under the state legislation that incorporates our body, we can levy a tax. For all of you who voted for our tax last August, thank you, by the way. That's part of the discussions. So we can do here in the Ann Arbor, Ypsilanti area, a relatively intense degree of service, including paratransit, including grocery ride, but it comes with a relatively high tax rate that not everyone in the county is interested in. And frankly, a very limited geography. We are limited in the state of Michigan to property taxes. That's the only funding source locally that I can use. Other states, sales tax, motor vehicle registration tax, payroll taxes, lots of other things. Not Michigan, property tax only. That's the same source of funding for municipalities and many other organizations. It also creates a very hyper-local approach to managing this money. The township has a tax to fund a bus service. They want to focus it within their township. If the doctor's office is 6 miles outside, how do you deal with that? So there's a disconnect between our local property tax funding areas and the needs of a transportation network, which usually transcend local borders pretty quickly. So I encourage you to look at mobility manager. I would encourage you to look at LETS. We mentioned the 196 operation. Suzanne mentioned that is an option. It is a possibility. Yes, you can have a countywide transit authority. It comes with a countywide property tax. You can't have one without the other. So if you go down that road, it's an option, but it's a big lift. And then finally, just in closing, without a countywide tax base, you're going to be left sort of with a patchwork piecemeal approach to picking up funding to provide these higher level services, which a lot of places do, but isn't good, again, from creating a viable network. You already have an authority in this area that can levy a countywide tax for public transportation. We haven't heard about the Regional Transit Authority of Southeast Michigan in some time, but I believe back in 2012, the Board of Commissioners agreed that we would join, and I believe the state legislature agreed that we, as Washtenaw County, would join the RTA of Southeast Michigan, with Oakland, Wayne, and Macomb County, City of Detroit. So we're a part of that. They came to the voters in 2016, narrowly missed a property tax win at that time. But their plans at that time and since then have always included a higher level of transit service throughout all of Washtenaw County. How it would be levied is all property tax. And it's kind of everybody in or everybody out. They were not successful in 2016. They can't do county by county, like the 196 could. But they came very close. And I know their plans, and all of their plans have always included services throughout all of Washtenaw County, primarily focused on the groups who might otherwise be isolated, folks, seniors, folks with mobility limitations, young folks who maybe can't drive yet. They really focused that. That is another option. In addition to mobility manager, LETS, you also have in the 196 option, you also have the RTA. How that is approached, I confess I'm not entirely sure. I think that conversation probably starts with maybe the Board of Commissioners or the RTA representatives for this area themselves. But I think that's another option or a tool in your tool belt. So with that, thank you very much for your time. I appreciate it. And I look forward to the next speaker myself. Thank you.
We're going to take about 10 minutes for you at your tables to talk about the presentation, and we'll do this after Kate and Jan's presentations as well. Just questions, what do you hear from the speaker? What did you hear from the speaker that would improve Washtenaw County's transportation system for older adults, and why? What did you hear from the speaker that might not work in Washtenaw County, and why? What would you need to know more about to make a more informed decision? So if you could just take 10 minutes at your tables to kick those ideas around, then we'll have about 10 minutes for each table to report out. Again, if one person could agree to be the spokesperson, we'll report that out, and then we'll go on to the next speaker. Yes, hi.
Hi, I'm Evelina from People's Express, and we talked a lot about ways we can get this awareness to the politicians. We talked about riders advocating to the politicians in their local communities, and hopefully that will lead to a domino effect. We talked about the benefits of a county-wide millage, and oftentimes the communities are not prioritizing the transportation in their local areas. And with the political atmosphere always changing, it's like campaigning 24/7. So we talked about a lot of how the county can bring uniformity and cohesiveness across the county.
Thank you. Who's our spokesperson at
So our table said, great to explore models, but we need to get beyond talking. Get something done, take an action. You know, some people are, this table are perfectly willing to pay an extra tax, a countywide tax to improve transportation services, but others are not, or, you know, just not enthusiastic about that. I think that the problem is communication, that we already have tremendous providers in our community. They may not be getting every spot within the community, but perhaps if they were collaborating and working together, they could do something about that. We talked about unreliable transportation and that we need to give feedback to our providers and hold them accountable when they call someone up, that they can get them where they're going. We said, why buy vehicles for senior centers when they could contract with an existing provider, which is much more cost effective. We asked if Feonix Mobility Rising is already providing countywide navigation services. We just don't know if we need a local navigator. We want them to be local. We want them to understand the places we need to go, the assets in our community, and our particular needs. We need to live in Washtenaw County. We talked about the cost of going somewhere. You know, sometimes you get like a list of options, and the lowest price one is $20. So there are people in our community who might not be able to afford $2 to get where they need to go. JFS is represented at our table, and they said they have a sliding fee scale. So I think that would be
Thank you very much.
Who's our spokesperson here?
Well, first, I want to let you know that we were very present. We weren't taking pictures of anything or notes. But we were engaged. We were really engaged in that conversation. And I guess the thing that I could share with you that hasn't been shared yet is we talked about the class competition that comes with transportation, meaning how it's presented and how it's perceived. And oftentimes people see public transportation as something for poor people and nothing that I would ever utilize, because I don't know if that's a regional thing, because in Europe, it's not that way. In New York, you're stupid if you have a car. But in Michigan, people say things like, if you can't provide your own transportation, I can't be bothered with you, because we have transportation. Personal transportation and public transportation is for the others, it's for another class, it's not for me and my family or my friends. And I kind of think that part of it is the way we are trained to address people and to cling to what's familiar and push away what's unfamiliar. And so it's part of that. We all are part of the community, and in the presentation, even there was a they, them, and we, and we are we, all of us. And when I feel that whenever we approach a problem and there's a we and them, the solution has already taken a back seat. So from here and everywhere we come in contact, we have to remember that. And I think that's a big hurdle that it may take a while to unlearn.
Hey, thank you. Good morning, everybody. I'm Justin Hodge. I'm the chair of the Washtenaw County Board of Commissioners. I'm really encouraged to hear how many of you are pro a countywide village. That's really helpful. Our table talked a lot about RTA and some of those other options, and since that's a county level decision we have to make, we were thinking a lot about what should we be doing next. We were specifically thinking about who needs to be appointed to the RTA board and thinking about the history behind some of the votes that have taken place where we haven't been able to move forward on regional transit. We also talked a bit about the Let's model, and with the Let's model, how the health systems have been supportive from a funding perspective on that, and what that might look like for us here if we were to move forward on that kind of model. And then to your point, this politician is paying attention and is interested in this.
Thanks, Jeff. This is
Good morning, everyone. My name is Mo Nakpal. I am the co-chair of the Ann Arbor Area Community Foundation Glacier Hill Fund, and also worked in transit in providing, setting up the air ride service a few years ago. Glad to be here for all your presence as well. So our table had some great ideas. Many of them have already been discussed, so I'm not going to repeat them. I do. I want to highlight a few things that can be done fairly quickly. Whether it's Feonix Mobility or not, I think if we are getting calls from seniors, people with disabilities, and if it's just going to the dispatcher, there's no reason why the dispatcher can't have their own signals. So that idea, again, we're joking, but there's no reason why we can't have that information available to the folks that are on the front lines. Right? We should have each other's information. If we can't do this, people express money or wait money, whatever, right? Whatever the solution is, perhaps just simply based on your zip code or where you are. Ironically, I do want to point out this specific location we're in right now is not covered. Right here. If you were to choose to come here, public transit, I'll give you an example, would have taken her an hour, and you would have to walk across the highway. You call that. So yes, it is darkest under the canopy. Right here. So that's one idea. The second one, the county village, I think there's a patchwork. We have to complete that hopefully in less than 20 years. That Sankey, hopefully Matt and Robert, you can help. Where there's a need, where does the money come from? But our thought was if you just took all the funds that are coming in and the people wherever they're located, and just simply do the math, we'll find that, okay, we're already paying a certain amount, right? And if it can be made countywide, perhaps we can spread the service where the needs are and cover the areas. Because again, there's three major hospitals right here in Ann Arbor Township. And lots of people influence, but obviously it's not necessarily something that's covered in the current service period. And then lastly, I think just making sure that whether it's continuing the consulting report or an additional where we collect this information, provide it to the right folks, and make the choices that benefit, not specific to class, race, religion, etc.
I just want to add that a countywide mobility manager, it would give us all one phone number.
Yeah.
That we could market to the community. It would be so much
Did you
easier.
hear what she said? Countywide mobility manager would give a single point of access. Hi, who's our?
I know.
Thank our group, we had a really good discussion about the importance of connecting sort of service agencies and transit agencies. And I think the main thing that came out of our discussion is that people don't travel along set boundary lines. So we're not drawing the lines in the sand, they're supposed to go. As an example, Alex Passage, Director of Disability Network, that now includes Washtenaw County. And one of the things that we've been working with through Feonix Mobility Rising and People's Express and other transportation providers is towards a mobility manager for the future. The area agency on aging, who is part of our group, is one possibility. They provide that service in both Wayne, Oakland, and Macomb County currently. But there is the opportunity for improvements, whether it's new technology and especially operating service. Oakland County has also passed a village recently. They hired a new transportation one way to go about things, not in any way. So I think just having this group together is a great start. Just want to make sure we do that. And to add on to
as our county is aging and with that responsibilities, when we provide additional service to everyone, we provide additional service to older adults and youth. So, the Say Yes campaign is also present at our table, and that was one question we had. And that funding we used for public transportation services.
Thanks, Julie. Who's our spokesperson here?
Good morning, by the end of time, Nutrition Services, we have really a lot to say about how the transportation system be improved. We were very interested in the idea that the structure for the transportation authority might be able to be changed. And we were interested in seeing if the current funding structure could change. We were also interested in whether or not the current tax millage could be influenced by the work of this body or information that came out of this structure. We feel like we need a lot more transparency in terms of the funding and also more data about how people are using it, what the gaps are, what seniors themselves think about it. I can tell you in my work at GFS, I work with care managers, we do a lot of mobility management. You know, finding rides for people, figuring out which system works. But of course, it's not covered by any transportation funding whatsoever. But it's not like that's not happening. So that's a really big need. We also obviously need much more operation funding when it comes to transportation. The things that were talked about pretty extensively. And we have some concerns about whether or not a countywide or statewide tax will work, where a number of us in this room are also working on a senior village, and so we don't want to let that go by the wayside either. So those are some of the concerns we have.
Thank you very much. And our last table, and then we're going to go online. Marie, in just a second. Who's our spokesperson?
Hi everybody, my name is Erica Barker. I am a student at the University of Michigan School of Social Work. I'm here with the Program Evaluation Group at Savannah. So we talked a lot about what has already been said, so I'm going to skip over that for you all. But we were curious, what's the capacity to increase participation in A-RIDE? Whether that's bus driver training to help folks on and off the bus, if that's a disability, particularly with groceries, right? So you see people going to Meyer, and then how do they get their groceries if they have mobility issues on the bus and off the bus? There's also storage limitations on bus systems. So if you have, 50 people on a bus now have their groceries, that's not a lot of room for folks. We also talked about this idea of the mobility managers and trainings for case managers to make it easier and more accessible for folks. So knowing this is the number you call, this is how we do all of this, what that look like. And then we were also very curious about the data that is asked on Michigan Medicine's transportation questions, because right now it doesn't seem like it's going anywhere, but that is very important. So if that's a problem that it gets flagged and then that goes to the case manager at the hospital or whoever is in charge of mobility transportation, that should be something that does happen, right? Because if you're asking this question, you're not doing anything with that. So that is us.
Good ideas, thank you. Marie.
Hi everyone, my name is Marie Bress. I'm the CEO of Cover LLC. I'm a part-time lecturer at Eastern Michigan University School of Social Work. I'm a member of the Washtenaw County Commission on Aging and the co-chair of the Healthy Aging Collaborative. Our group talked a lot about that last question. What would you need to know more about in order to make an informed decision? When we talked about the RTA and the 196 information, one question that we had was what would be in the next millage if they were to propose it, and how that affects current millages with the Ann Arbor Area Transportation Authority, their partnership with the WAVE, et cetera. So that's something that we would want more information on. We discussed some of the existing vehicles and resources, and if these smaller agencies are able to maximize those resources, such as school buses during the day, church buses, things like that. we discussed the transition from gas to electric. One agency shared that they're installing an electric charging station for themselves, but that's a huge cost for an agency. And so I'd like to see federal, state, or county investing in that transition, and wondering if there's more information there. Another model to consider that our group brought up was veterans do have a network of services, including transportation, and so wonder if it's been looked into how that is supported. And then how can we do a better job of serving low-income people who have less options? And you other groups made some really great points about that already, especially that it would take an hour to get to the location that you're at right now. And I think that was it from our group. Thank you.
That are taking notes at the table, to leave those on the table when you leave, so that we can get them and compile them, make sure that we include them in our work from today. Our next speaker is Kate Schramm. Kate is the Director of Programs and Partnerships with Feonix Mobility Rising. She's based in Yankton, South Dakota, a little south of the North Pole, right? And where she works remotely with the Feonix team and project partners across the United States. She has an educational background in biology and chemistry. She served as a teacher and then leading a youth development program for her community action agency. That helped her transition into transportation because she saw it as an opportunity to work on an upstream challenge that you're having on many of the services she had previously sought to improve. She works with partners across the United States, Feonix does, to implement changes to mobility, the mobility ecosystem, and for the health and well-being of every person. Kate, thank you.
Hey, thank you so much for welcoming me to your community. It is so great to be here. I've met a lot of people in this room on Zoom. And as we all had done that for several years, that was kind of what I was used to. And then I loved traveling to the communities to actually meet the people in person. So when COVID hit and I wasn't able to do that anymore, that piece really hurt my heart. I do want to acknowledge my colleague in the room, Rebecca Yachik. She is our local Feonix person on the ground. So she lives right here in Ann Arbor and runs the work that we do in Washtenaw County. So, all right. She deserves that. All of your comments may have taken the presentation I was supposed to fit into 20 minutes and already be really difficult into like impossible because I'm like, oh, I should mention that, I should mention that, I should mention that. So I'm going to try to work in a few things just based off of what you guys are saying, but whew, we could have 12 discussions like this, right? So what I want to talk about today and focus on is not specifically the work that Feonix does, but some mobility concepts that I think will help this group as you're looking at what possible solutions you'd like to see in your community. So I'm going to talk about this term mobility as a service, or MOS, which is a huge buzzword in transportation, and everybody has different definitions for it, and those definitions have changed. And I think when this group was first talking with me, the term central access was kept coming up. And really, those are about the same thing, depending on what definition you want to use. So I'm just going to call this mobility as a service, central access, and more, and describe how those things all work together to provide a better mobility ecosystem. So Feonix is a nonprofit
we started in 2018, March of 2018, so 5 years, whoop, whoop, with a mission of mobility solutions for the health and well-being of every person in every community. So yes, we do focus on older adults, and I certainly want you to listen to what I'm saying with an ear for older adults, and I'll try to kind of navigate it in that direction. But I think Matt made a really good point in saying that you don't just focus on one group when you're looking at the mobility ecosystem, because one group can't bear the responsibility. You do, however, focus on their unique needs within the mobility ecosystem that you're creating. So just to tell you a little bit about Feonix, because some of you are probably like, who is this person? Why is she even talking to us about transportation and in our community specifically? So Feonix, in our short 5 year, well, actually, we're only going with 4 because we're not going to include everything we've done since kind of we had to pick a stopping point, right? So we've worked on projects in 9 different states across the US and given over 46,000 rides. Now that doesn't mean that Feonix is providing the rides. That means that we're coordinating the rides. Sometimes we have our own transportation providers in communities, but certainly not when the ecosystem doesn't call for it. If there's great providers, those providers get the rides, right? We've delivered over 19,000 pounds of food in coordination with other transportation providers and volunteer drivers, worked with over 204 community-based partners. So that's why my background with education and community action and working at a religious institution, that's why I can stand here and talk about transportation, because I can navigate those systems and I know not exactly, that's a bad statement. I know some of what people working in those fields are going through trying to get their clients, their patients, whoever it be, family members, I'm now personally experiencing it with grandparents, to where they need to go. And then we work with over 48 transportation providers, because I will never say that one transportation provider can provide transportation for an entire area. I think that public transit is fantastic. We are huge public transit advocates, but it is simply not fair to put the whole burden of transportation for a community on only a public transit agency, right? So we have to have these collaborations. So we've worked with 48 transportation providers. All right, so mobility as a service. Mobility as a service, the way that I'm going to define it when I talk about it is this one-stop shop for mobility. So that was kind of the original definition, right? And it was this see, book, and pay for all your transportation needs. And when mobility as a service, or the term MOS, first came on the scene, it was in Europe. And it was looking at congestion, traffic congestion, and how do you get business travelers to where they need to go without them having to drive a car, without everyone having to have a car. And that's great, except, and it's really attractive, right? And you can use all sorts of fancy technology to do it. But business travelers are really not the ones who need our mobility solutions most of the time, right? Business travelers are kind of good at figuring it out, and they've been doing fine. Like, we were trying to amplify what they were already doing and make it better, reduce congestion, sure. But we weren't really solving a great social need. And so now mobility as a service has also incorporated this mobility wallet concept. And when that happened, it went from looking at how do we get business travelers from point A to point B to looking at who has mobility needs, why aren't they being reached, and what can we do to help those most in need of the services? Often that comes down to a cost, right? Or some sort of disadvantage. So mobility as a service became more about looking at transportation equity. How do we help those who can't pay for the ride? How do we help those who don't have credit cards manage funding to pay for rides? And it sort of changed the way it was looked at.
This is a graph that pretty much explains what I was just talking about, but for all you visual people out there. So, you know, we were in this like, we can do really cool things with technology. Again, it's back to Europe, right? And then there was like, oh my goodness, this is so cool. There's all this buzz all around, right? Around the entire world. And all these technology companies were racing. Who's gonna have the best MOS app? Who's gonna pull this off? Who's gonna do the one click, one tap, one call service? Where can I go to look for all my transportation options? I can click on that and I can pay for it. And we got to this like, really this height of excitement. But that was all based on technology, not what are the needs of the people, what technology system can we use? And so, because technology is what it is, right? We went on this little downslope, this little crash, where it's like, oh wait, technology didn't solve all of our problems? Darn, now what do we do? And I believe we're on the upswing again. Because now we've looked at how do you use technology and pay attention to the social need, blend those together to create solutions for those that need them most. So we're not too enlightened yet, but we're getting there. All right, so I am no expert on these projects. I just want to put that disclaimer out there. But I was asked to expose the group to some projects that are happening with this concept of mobility as a service. Where can you see all your transportation options in one place and be able to book them and pay for them? And so these are some pilots that are happening in the US. Los Angeles has a great one in South Los Angeles. Theirs has a couple components to it. The idea of universal basic mobility, that mobility is a right and everybody should have access to mobility. That's universal basic mobility. And it has an environmental component. They're putting a lot of electric cars in place, California. Oakland, California has another pilot with the Oakland DOT. And there, people are being randomly selected to receive funding for their transportation. So they're not only increasing the transportation options that are available, they're actually paying for it for individuals. And then in Pittsburgh, there's a Department of Mobility Infrastructure that has put into place a lot of micro mobility solutions to connect into other mobility options. And so you can go to these stations where you can get a scooter or a bike and then be able to connect to the public transit system if you're not close to a stop. So there's micro mobility where there are not bus stops to try to fill in the gaps. Now, what do these all have in common? They're all in urban areas. Okay. Besides the work that we're doing with communities across the US, I couldn't find, now this doesn't mean there isn't, but I couldn't find readily available info on MOS or universal basic mobility pilots that Feonix isn't involved in. And I didn't want it to just be the Feonix show, right? I wanted to expose you to what else is out there. So it's easier in an urban area. In Washtenaw County, you have both. You've got Ann Arbor and you've got rural areas. So it's not like this doesn't apply to look at what these urban areas are doing. But then I think we also have to talk about the rural component too, right? Because they both matter. I'm from a very rural community, so I'm kind of passionate about it. Okay, so why are we looking at transportation barriers? I'm not gonna spend much time on this because I don't think I need to convince this group, right? So you're already looking. But just some staggering statistics about how transportation is affecting people's lives. 5.8 million Americans miss medical appointments due to the lack of transportation. And then a bunch of those individuals go into the emergency rooms to get their care, which is not good for the individual, it's not good for the health system, it's not good for insurance, it's not good for anything. 43% of respondents to this national survey had said that transportation was the root cause
Because there are programs that address food insecurity. But the lack of the ability to get to those programs is the actual root cause. And then 45% of Americans have no access to public transit. A lot of that is rural, right? A lot of that is rural communities, but even in urban areas, there are places where the buses just don't go. They have limitations. So transportation, we believe, Feonix believes, is really a health equity issue. And so the real reason that we need to address transportation is social determinants of health. Just a little background, this is, I said we're on this path to enlightenment, and that's worldwide. This is really starting to be the focus, it's noticed. Harvard did a study on poverty, and they determined through this longitudinal study that transportation was the #1 determinant of a child escaping poverty as they grew. So you can look up that study, it's fascinating. I don't have time to talk about the whole thing, but basically it comes down to, access, commuting time to jobs, and commuting time and access to resources that then leads to being able to get out of poverty. And then the World Economic Forum and the World Bank are looking at how transportation is one area where there has just been systemic racism for years and years and years and years and years. And so now looking at how fixing mobility ecosystems is one of the steps in fixing race, anti-racism. Okay, so we know there's a challenge. And now, you already knew, but we have staggering statistics about why we should solve that challenge. So what's the problem? Why isn't it being done? Well, because it's very fragmented. There's policies all over the place and programs all over the place, and everyone is doing something just a little bit different, right? And so you've got this labyrinth that then somebody, usually some poor social worker at a community-based organization, has to try to navigate so that they can help their client. And it's hard. The experts can't figure it out without years and years and years. And we're still like, oh, that's interesting. I never knew that about the mobility ecosystem, right? It is complicated. But I believe that there is hope. And I think the hope lies in collaborations and bringing all of the stuff, the fragmented labyrinth, kind of under one roof and exposing everything that's there and everyone being transparent and collaborative and working together. So we, Feonix, we call our model a transportation assistance hub. Again, I don't think it's so much what does Feonix do that I'm trying to get across to you. It's these are the components that we believe are necessary for mobility solutions for all social determinants of health. So there's a staffing component. I think, we've talked about the mobility manager, and I'm going to talk about a mobility navigator, because we didn't want to use the term mobility manager because we don't want to step on public transit's toes. There's a mobility manager in the public transit space that already does amazing, amazing, amazing things. And we don't want to say, oh, and they should do one more thing. No, there's another component there. And then technology. So yes, this ability to call in to a call center, go online, or go into an app, all three of those, call, notice how I said call first, because I still think we're there for the majority of people who need access. I think we're at call. Some people will use online and app, and it can be there. And be able to see all the options, pay for all the options, and get the support you need, that's important. And then the community collaborations and capacity.
I don't talk a lot about capacity, again, because 20 minutes and I'm already running out of time, but if the transportation resources aren't there, then you don't have an ecosystem to put together. So capacity is actually a really important part of it, right? It's funding, it's the transportation providers, and those are kind of the baseline. But we're gonna assume we can get that, so I'll talk about funding. That's important. So a mobility navigator. Okay. A mobility navigator is like this superhero of transportation resources, right? When Feonix goes into a community, one of the first things that we do is we put together a transportation resource guide, the sticky notes. We put the sticky notes together into a fancy PDF, and then we can share that with any of our partners, okay? And the mobility navigator role is responsible for understanding everything that goes into that transportation resource guide. And they're connected in to the navigators of every other place. The hospital has navigators, food banks have navigators, community action agencies have navigators, area agencies on aging have navigators, social workers, navigators, we all call them something different. But this person's connected into that group so that it's their job to be the expert on transportation. It's not the food bank's job, unless they want to, but I mean, they're already overworked. It's not their job to be the expert on transportation, right? But there's this new role. They're the expert on the transportation that communicates with all. And they lead someone through the whole process. It's not just what are my transportation options. It's, well, I had a car yesterday, my car broke down and I need a $300 part. Well, okay, we could put them in a program that pays for rides for them for a month, and that's gonna be $2,500 worth of rides. Or we could help them find a program that will pay for that $300 part, fix their car, and we've now solved their mobility problem without providing them a ride, right? We've gone back to like the root of the problem. They have a car, they have a license, they still have the money to fix their car. Okay, so there's a whole bunch of things that go into why someone doesn't have transportation. And the mobility navigator can help figure that out and make a plan so that this can be sustainable for them to get to where they're doing it on their own, right? We can't just pay for rides for people indefinitely either. That's not sustainable. But can we help them figure out how they might be able to get to that point? Is it a job? Do they need the rides to the job so that they can build up 3 months worth of wealth? Okay, I have to wrap up. All right, the community leadership circle, the mobility leadership circle, that is where all those social workers and the leaders, the political figures, the decision makers at the organizations, managers, everyone in the community comes together to talk about the mobility challenges. This is why it's confusing. This is why it is hard to figure out. There are 130 different federal funding sources that can be used for transportation. Some involve criminal justice and getting re-entering citizens transportation to be able to get to work, as an example, right? There's Department of Justice has them then, that's why it's complicated. You can fit transportation in to a lot of these funding sources. And then this will be available to you. I don't have to talk through it, but they wanted me to give examples of what the transportation sources, or I'm sorry, the funding sources we've used in our communities are. And so our slides will be available. So you'll be able to look that over and you can get a hold of me if you have questions. So equitable mobility as a service involves that call, click, tap to be able to get to all your resources and have someone help you navigate that.
Go back into our tables again, to then discuss the presentation. We heard from the speaker that would improve our transportation system for older adults. Why? What did you hear from the speaker that might not work in Washtenaw County? What would we need to know more about to make more informed decision. So we'll give about 10 minutes. We're running slightly behind, but maybe I'll give you a shout in 7 minutes and then we'll have you. Thank you. We'll start online this time, kind of go backwards. So Marie, you want to, and we're running a few minutes behind, so
Yeah,
perhaps you could pick your top 2 or 3 points from each table, and
yeah.
we'll go a little quicker. Go ahead, Marie.
So we were talking about a lot of the things that we, can you hear us? Okay, great. So we were talked about a lot of things that were spot on, the social determinants of health, that fragmentation is a problem. We talked about hooking bridge cards to transportation payments. And then we spent a lot of time talking about how funding is such a red tape that it's earmarked to specific things. And we had more ideas around that, and I can share those in our notes, but that's what our conversation was centered around.
We focused on these questions of like, how are corporations going to want to get involved with what we're doing further? And then how do we amplify that support? So if we are utilizing funds from Toyota, for example, how do we get them to help us more or use these resources in order to create the best support that we can? We also talked about this idea of seniors versus seniors who are low income and these sliding scale payment things. And then versus like tech support versus people who are not. So there's a whole lot of factors that go into this that we would have to then figure out and utilize in order to figure out the solutions. But yeah, those are some thoughts that we had.
Thank you very much. How about this table?
Hi, we were really interested in the 130 sources of funding and how we might approach that. Would it be as a collaborative? Would it be individually? That doesn't seem like a great idea. So we got to the idea of, what a central hub might look like. Would we have a transportation czar? But how could we work together to sort of understand those better and maybe take advantage of them? And the idea was just start someplace, do something and try something innovative, and maybe it'll start on a small scale.
Great, thank you. Matt, would you like to be called the czar?
No.
No. Who is our?
Now, I would not like to call.
Who's our spokesman?
Hi, I'm stepping in, Phyllis Herzig. So we talked a lot about how the having a navigator as opposed to a manager was a really good idea. And one of the things we touched on was how important looking at the root cause of why the transportation is a problem. And that, I think, would also fit into all the other services and needs that people have. So it really is very intertwined.
Thank you. Who is our spokesperson here?
All right, it's me again. Yeah, we also had this question about, how do we coordinate across all the different organizations that provide the funding, and kind of came back to the county-wide thing. Keep coming back to that. How do we make sure it's equitable? How do we make sure it's consistent for no matter where you're in the county? We talked about the sources of data, a couple of sources that you had, a slide. Sue Ann's been trying to find the information from Michigan Med, so I don't know if anybody in the audience can help with that. But if you're collecting the data, we should have access to it. And if you have some sources you can point us to, I think that would be very helpful. Thank you.
Yeah, data is something we need to not lose sight of. We just don't have data. Centralized hub to collect data. There's other ways to collect data, but let's not forget about data, because we don't know how big the problem is because we can't measure it.
Are you? I think I.
You're it again?
No, do it again. Oh, you pointed at me. All right, great. Yeah, so we talked a lot about, well, first I'd say that the statistics around food insecurity and how transportation is connected to that really spoke to me. We talked about how preferences are going to have to change and that hopefully the next few generations will prefer public transit over owning a car. We talked about culturally why in Michigan that it's the norm and the expectation that you have a vehicle. It talked about, the history of redlining and how our highway systems are designed to facilitate people having to have a vehicle because highways are designed to not connect certain communities. So from an infrastructure perspective, things are going to have to change. And then from a personal preference perspective, things are going to have to change. You spokesperson again?
We'll go this way.
Sorry, we're going this way.
Yeah.
Guess we get an A for effort. And we just skip down to what more we need to know. It felt like someone woke up one day and said, this is the problem. But the technology, anybody over 60, we've lost them. The scooters, we've lost them. And then, the people who have cars, we've lost them. And it's like, how do we get everybody even interested in another layer? Because I understand that we need we understand, I'm not here by myself, but we understand that it would be helpful to have this navigator. But the example of the car, you get the car part fixed. Well, suppose then there's a nervousness in the car because the last time I had this problem, there was a bigger problem and blah, 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 because there's a mental health challenge there. Or, the social workers, the reason they're one of the reasons they're in really small organizations is because if you get too big, then the person is just a number. And when there's a different shift in what's going on, it takes longer to address that. So we're just wondering, how's this gonna work?
Okay. Thank you.
We just thought there was a lot of rich ideas in that presentation, and we would just like to be able to have the presentation and spend a couple hours looking at it, because we want to let it all sink in. But I think that there was one slide that was talking about how you don't just need a navigator, you also need like a fundraiser and another position. And it occurred to me that every single one of our providers is struggling just to maintain their programs. And if we really hope to provide a universal transportation system throughout Washtenaw County, we need more resources, not just sustaining. We need to, knit these pieces together. And that's going to take a lot of money. And there were some other funding things I think that we talked about. One of the things was that timing is a complicated factor, and we feel like we need to talk about that too. There are dialysis patients that need to get where they're going by 5:30 in the morning, and we can't provide those services. And so we're sort of in the trial of disillusionment at this point.
Great thoughts. Thank you.
Yeah, so I think one of the biggest pieces that we recognize in this group is that that this job is just not for one person, that it does take a community, and there will need to be more community involvement. There needs to be a hub, or just more mobility navigators and more mobility managers to support the community.
Thank you. And our last table?
Our group focused a lot on how to navigate all those funding sources. We talked about like, can the state maybe have a compiled list of funding sources on the state and federal levels? And then the local communities, all the foundations and organizations that offer different grants, a lot of them come with different eligibility requirements, a lot of even maintaining those reporting standards. There's a lot more to do once the grants are awarded. So knowing that before you get into it, looking at, are the funding sources long-term, short-term? We don't want to implement any services that would be taken away after a short-term period. So we had a lot of questions on how we could navigate the grant world better.
Thank you, and you just teed up our next speaker. Thank you, everybody. Remember to leave your notes there, and our last speaker this morning is Janet Geissler. Geissler, is that the correct name? Yeah, Geissler, from MDOT. As the Mobility Innovation Specialist at MDOT, Office of Passenger Transportation, she's responsible for leading MDOT's implementation and coordination of projects to demonstrate the feasibility of emerging technology and innovative service models for the statewide public passenger transportation network. After a career in newspaper journalism, Janet joined MDOT about 10 years ago as project manager, working directly with the public transit agencies on things like funding and compliance. She was then promoted to unit supervisor. She directs a team of project managers serving transit agencies primarily in the southern half of Michigan. Well, at least she did that. In 2019, she stepped into the newly created position of Mobility Innovation Specialist, working to advance the use of transit technology to improve transit operations, accessibility, and equity. Janet, thank you.
Well, hopefully I can answer some of your questions about the funding sources. That is kind of the dry part of the talk, but we know we all need funding in order to make transportation happen. And then I'll be sharing with you some of the exciting innovations that we're working on that can improve transportation for seniors and everybody else. First, just a little bit about, let's see, about the Office of Passenger Transportation. We administer MDOT's passenger transportation program statewide, which includes the local public transit, intercity bus, which is Indian Trails and Greyhound, and the regulation for for-hire passenger transportation, which would be the charter buses. We do not provide any direct transportation operations ourselves. We provide assistance and oversight to over 135 public transit providers, and we're the direct recipient of federal funding for rural transportation. In Washtenaw County, you can see this is a statewide map that shows the different types of service that are available in each county statewide. In Washtenaw, the blue circle represents urban service, that would be the ride, and the yellow square represents specialized services. These are agencies that receive state and or federal funding for service that is primarily targeted at seniors and persons with disabilities. Washtenaw County has a lot of those providers. That would be WAVE, Northfield's Human Services, People's Express, Milan Seniors for Healthy Living, Jewish Family Services, and the Manchester Area Senior Citizens Council. So some of these federal funding sources. Federal funding, that's the biggest pot. The RIDE gets the funding directly from the Federal Transit Administration. Urban agencies are direct recipients of the federal funds. MDOT, most of the federal funds require local match, typically 20%. And in Michigan, MDOT picks up that burden. We provide the local match. In other states, it's often up to the individual transportation provider to come up with that money locally. The Office of Passenger Transportation is the recipient of the FTA funds for the rural providers and for some specific FTA grant programs. We allocate that money to the different transit agencies around the state in various ways depending upon the program. Then there are other federal programs that may provide funding that can be used for transportation, Those would be programs like Medicaid, Veterans Affairs, the Older Americans Act, the US Department of Health and Human Services. MDOT's not involved in any of those programs, but those are options for other transportation funding. Some of the specific FTA programs that most directly impact seniors. 5307 is formula funding for the urban areas. It's primarily used for capital and planning. In certain circumstances, it can be used for operating funds. And this is the funding that goes directly to Ann Arbor's, to the ride. Section 5311 is formula funding for rural transportation. That money goes to the states. Each state determines how to use it. MDOT reimburses agencies for a percentage of their operating expenses for the rural service. A portion of that does go to the ride, and they contract with Wave and People's Express to provide some service in the rural areas. The ride's fiscal year 24 5311 operating budget is a little over $3 million. And there's section 5310, which is the Enhanced Mobility of Seniors and Individuals with Disabilities program. This is a formula funding grant that's intended to improve mobility for seniors and people with disabilities. It's primarily used for capital, such as vehicles and dispatch equipment. It's also used for mobility management and some operating expenses for service that goes beyond what's required by the Americans with Disabilities Act. Separate allocations go to Ann Arbor and to MDOT. In fiscal year 23, Ann Arbor's allocation was about $360,000. Michigan got 2.85 million, and that's to be distributed statewide. For the statewide share, transit agencies or the providers that are eligible for this kind of funding submit requests in an annual application, and MDOT makes awards based on priorities that were identified in the application instructions, and we use all the available funding. Again, MDOT provides the required match. Eligible recipients of this funding include nonprofit agencies, and the projects must be derived from a locally developed, coordinated public transit human services plan. And then there are also some miscellaneous competitive discretionary grant programs. State funding. As I said, MDOT provides match for the capital grants like the 5307 and the 5310. Then we provide local bus operating assistance. This goes to all the public transit agencies in the state, such as the RIDE. One thing to note, a public transit agency is not the same thing as a public transit provider. To be considered an agency that's eligible for local bus operating or LBO, the agency has to be incorporated under one of several specific acts, state acts that spell out things about how the agency may or may not levy taxes, where they may operate, things like that. Those acts include municipalities like cities and counties or authorities like the RIDE. 5310 agencies are not eligible for local bus operating funds, but agencies can contract with 5310 agencies to provide the service. So for example, that's what Ann Arbor does with the 5311 funding. They contract with Wave and People's Express, which are 5310 agencies, to provide service in the rural areas. Then we have specialized services funding. When the federal government created the 5310 program, nonprofit agencies could now get buses. They said, great, you gave me a bus, but I don't have any money to run the bus. So the state created the specialized services program to fill that need. The funding is allocated each year by the legislature. That funding had not gone up in decades. And it was never enough to really meet the need. We reimburse agencies on a per passenger or per mile basis. It's their option, how they want to be reimbursed. The current reimbursement rates are $4.07 per passenger, or $1.20 per mile, or 29 cents per mile if the trip is provided by a volunteer. The service has to be coordinated at a county or regional level. In Washtenaw County, the RIDE is the coordinating entity, and then so Ann Arbor receives the funding from the state, and then it is allocated to their subrecipients based on local agreement of a coordinating committee. They allocate funding to WAVE, Northfield's Human Services, Mylan Seniors, Jewish Family Services, and Manchester. Now, last year, the legislature did give us, for the first time in decades, an increase. Not a big increase, but an increase nonetheless. We decided to increase the allocation to each of the existing recipients. We're continuing to analyze what to do with this money. Do we want to further increase the allocation? Do we want to revise the reimbursement rates, which haven't changed in decades? Or do we want to expand the program to new recipients? We also have, kind of lost, whoop, went the wrong way. Going the wrong way here again. There is also some special funding from the state. This is primarily to fund pilot projects to demonstrate new technologies and innovations. So now I'm going to talk about some of those innovations. Let's see. Here we go. So statewide MOS platform. Kate introduced you to the concept of mobility as a service. MDOT has the ambitious goal of creating a statewide MOS platform. The goal is to make mobility as easy and seamless as possible. We aim to be the first state in the nation to tackle this on such a large scale. Kate pointed out some cities or regions that have MOS. Vermont has a kind of low-level statewide MOS platform, but the whole state of Vermont has 7 transit agencies. You heard that Michigan, we've got 81 public transit agencies, not counting all the 5310 providers and the specialized service providers. So at a minimum, what this would be, it would be an app that you can call up on your phone, no matter what part of the state you're in. Open the app, type in where you want to travel. You could, if you're traveling locally, or maybe you're planning a trip up north or to Detroit and you want to see what's available when you get there, you can plug in your desired travel area, and it will call up information about who are the transportation providers in that area. At a minimum, it will be the public transit agencies that will show you their information and how to contact them. We ideally want other transportation providers to join this platform. So it wouldn't show just the local transit agencies. It could also show you Uber. It could also show you bike share. It could also show you Amtrak, whatever options are available. Based on the transit providers' capabilities and the technologies that they have in place, the app may also enable you to do things like plan your trip, book your trip online, pay for your fare online. We're hoping to issue an RFP later this year. Right now, it's looking like it'll be around October. This says we hope to deploy in fall of '24. I think that's exceedingly optimistic. More likely, as we delve into this a little bit more and learn all the complications of pulling this off, I'm thinking it'll happen in 2025. Okay, another innovation are automated wheelchair securements. Typically, when somebody in a wheelchair rides a bus, the driver has to manually secure the chair with a system of hooks and straps so the chair doesn't roll around when they're driving. The automated wheelchair securements allow the wheelchair user to secure their chair on the bus without the assistance of the driver. They simply roll the chair into the spot, push a button on the wall, and arms come down and secure the chair. In Michigan, this was originally deployed at the Ride through a grant that they received as part of the $8 million Michigan Mobility Challenge. Since then, we've gotten grants to expand the use of these, and they're also being used at agencies in Jackson, Port Huron, and Saginaw. And the Wave will also be getting one of these securements. Currently, these kind of devices work only on large buses, but there are companies working on technologies that will create an option that can be used on small buses as well. The Able Link Wayfinder app, this is kind of cool. This is an app that helps people with cognitive disabilities travel independently. So seniors with mild cognitive impairment could ride the bus without assistance. It provides tactile, audio, visual, and text prompts throughout the rider's journey. So for example, it will show a picture of the building that you're going to, so you recognize what your destination is if you need that coaching. It will provide prompts that will say, it's time for you to get off the bus. It will tell you, walk to the corner. It will give you step-by-step directions how to get where you need to go. And it also allows a caregiver or family member to track their loved one or their client to ensure that they're on route. And if they go off route, it will let them know, and help can be found for that person. Locally, a grant was awarded through the Michigan Mobility Funding Platform, which is a collaboration between Michigan's Office of Future Mobility and Electrification and MDOT that provides grants to mobility and electrification companies to deploy technology solutions in Michigan. The Michigan pilot is a collaboration between Wave, SMART, which is the agency in metropolitan Detroit, and PEAK, which is a nonprofit in Ypsilanti that advocates for transportation equity for people with disabilities, including travel training, cycling, and using public transit. Automated vehicles. Okay, I know people get nervous about automation, particularly older people say, I would not feel safe. I would not trust a vehicle without a driver. You're already on that path. Think about when you're in an airplane. Do you think the pilot is up there steering the plane the whole time? No. That flying is generally an automated task. There are parts when the pilot takes over, but just like that, as we introduce automation in vehicles, there will be a safety driver. Yeah, the vehicle will operate autonomously sometimes, but there will be times, at least in the early stages, where the safety driver can take over. Think about the automation you have in your own vehicles. I have a 2019 Toyota, nothing fancy, nothing special. It's got automated, the ADAS is what it's called, Advanced Driving Assistance System features, which are the kind of the stepping stones to full automation. Things like adaptive cruise control, anti-lock brakes, lane departure warnings. My car will switch back and forth between high beam and low beam headlights. It detects the light conditions and the oncoming traffic. My windshield wipers, they detect based on the speed that I'm traveling and the amount of precipitation that's coming down, how often to swipe. We have collision warnings, we have traction control. So we're working towards automation. The goal with automation is safety. There's statistics that say something like 94% of vehicle accidents are caused by human error. The automated vehicle eliminates a lot of that. Your field of vision when you're driving is like this, right? The automated vehicle sees 360 degrees. They see what's in your blind spot. They see what's behind you. People are distracted by their cell phones, by changing a radio station, by eating, by kids in the back seat, by a dog in the car. The automated vehicle is not distracted. How many times, even today on your way here, how many people saw other cars running red lights? All the time, right? That won't happen in an automated vehicle. They obey the traffic signals. There's an automated bus on the Michigan State University campus, and I asked some of the people I know out there if they've had any experience with it, and they said, oh, it's great, as long as you're not behind it. So, what do you mean? They say, it's so slow. Like, they're going the speed limit. Everybody else is not, but the automated bus obeys the speed limit. In 2021, there were nearly 43,000 fatalities in US car crashes. Waymo is an autonomous vehicle company that has been demonstrating vehicles in a couple places in the country. And in January, they reached the 1 million mile mark of operating autonomous vehicles without the safety driver. And they just released some of their safety statistics, which I found really interesting. In that million miles, they had 18 minor and 2 major contact events where the vehicle had contact with another vehicle or an object. A major contact event means it was reported to police and at least 1 vehicle was towed. In those 20 accidents, there were no injuries. 9 resulted in no damage to any vehicle. And of the 11 accidents that had damage, 8 were just dents and scratches. None of those contact events occurred at an intersection or involved a vulnerable road user like a pedestrian or a cyclist. Every single vehicle-to-vehicle contact involved 1 or more road rule violations and or dangerous behaviors on the part of the other driver. 55% of those accidents occurred when the Waymo vehicle was not moving. For example, somebody backing into it. There was one kind of freak accident where, and this could happen to any of us, a portable plastic sign blew over and hit the vehicle. I thought it was really interesting. They made a note that the vehicle was traveling at about 11 miles per hour and the sign was traveling at about 3 miles per hour. The most serious accident occurred when the Waymo vehicle was slowing down to stop at a red light behind other cars that were stopped, and they were rear-ended by the car behind them. The rear-facing Waymo camera recorded that the driver of that car was looking down at their cell phone. So we're involved in a couple autonomous vehicle projects. The shuttle that you see here on the slide was part of the $8 million Michigan Mobility Challenge, and that was piloted at Western Michigan University. We are part of the National Automated Bus Consortium. In fact, Michigan is the lead agency, and that consortium will demonstrate the use of full-size automated buses in various service environments around the country. DDOT in Detroit is a member of the consortium, and we're hoping to get funding to get WAVE into the consortium. And I mentioned the automated bus at Michigan State. Quick note about equity and accessibility. Enhancements that target seniors and people with disabilities really benefit everybody. You know, when we do something for one population, we all benefit. Think about things like curb cuts that were designed to help wheelchair users. Who doesn't appreciate not tripping over a curb? We also recognize that not all users are comfortable with or adept at using technology. They might not have access to a smartphone or a computer or a credit card or a bank account. And so whenever we're doing a project that involves new technology, we are ensuring that it includes a non-technical tech option. So for example, the MOS platform, yeah, it will work best if you call it up on your phone, but there will be a phone number that you could call or a website you can go to. We're very conscious of this and want to make sure that we address everybody's transportation needs.
Thank you, Janet. All right, we're gonna have one more round of tables, but we're gonna change it up a little bit. I'm gonna call an audible here. Take the first 5 minutes to jot down your comments as you did before, but then take about 2 minutes to come up with a question for one of the three presenters. And we'll try to get a question from each table, and it will go as long as we have time. All right.
Not do.
Okay, we'll start.
So to give a little context for the people in the room, I used to work at Michigan Medicine as a researcher for the Center for Disability Health and Wellness. And one of the projects that I was working on while I was there was translating these research articles about how autonomous vehicles are not accessible for people with disabilities or mobility issues. And how we need to be involved in the process of developing these vehicles instead of retrospectively trying to fit them for things. So my question is, how do we coordinate with, for Janet, please. How do we coordinate with auto vehicle makers and producers to make them accessible for people with disabilities or physical mobility issues as a primary source instead of retrospectively?
Yeah, there are a lot of
There are a lot of components that go into making a vehicle accessible. As you can just, getting on the vehicle, we start there. It's easy enough to ensure that a vehicle can have a ramp that folds down when it stops. We can put these automated wheelchair securements on those vehicles so they wouldn't need the driver's assistance with that. But then there's other things too. What if they need some other kind of assistance? There's developments in using like artificial intelligence. I just saw an article yesterday how General Motors is working on using AI in vehicles so that if a person needed help, they could speak to the vehicle and it could provide an answer. Autonomous vehicles may be able to be connected to a remote operator who, depending upon what the need is, they may be able to provide assistance. For now, there will be safety drivers who could provide the assistance that somebody might need. As when we get to a point where there is not a driver, there may be some other kind of assistant on the bus who can provide the kind of customer service that people need without having to have the skills of driving the vehicle.
Good. I think my battery's dead.
Is that
Thank you. Who else has a question?
Oh, I have a question.
Yes. Could you introduce yourself too? Somebody said, make sure they.
Everybody, it's Justin Hodge again, Chair of the Washtenaw County Board of Commissioners. My question is for the rides are. Maybe this is, I don't want you to speak on behalf of the rides and they have a board and all that to think about, but I would want to understand from your perspective, how would you like us to be thinking about regional transit? Do you think it's worth us really getting back into thinking about the RTA, or should we be thinking about something like LETS or some of the other options that you came up with?
This is a part where I take the seizure.
It's okay, usually I'm over there and people ask me the hard questions.
Yeah, I was gonna say thanks, so I'll forget it. So regional transit politics in Southeast Michigan is complicated. It's been going on for a very long time. It's frankly only had a few minor successes. For transportation to work, in my professional opinion, it has to work at least a regional scale, township by township. Yeah, you can do a couple of things, hyper-local. Beyond that, you hit a wall real fast. By regional, I kind of mean, county-wide, the greater Milan area, maybe like the smallest unit that I would geographically think makes sense. In terms of where to go from here, I have to watch my P's and Q's because the ride has no statutory jurisdiction outside of Ann Arbor, Ypsilanti Township. Pittsfield, Scioto, and Superior have contracts with us for very limited engagements on the periphery. Outside of that, I don't speak for anybody. And at that point, we start looking into making sure I don't step on my partner jurisdiction's toes. That right now is the RTA. They're the ones who have that jurisdictional authority for something like, well, frankly, for transit planning. I do believe that is legally their job. They're the ones who have taxing authority. I do not. The RIDE does not have taxing authority at a county level. I couldn't do it if I wanted to. So I'm happy, as RIDE is happy to, as a good neighbor, as a good citizen, to be a resource, to try to answer questions, to provide context and professional opinion and perspective. But we are not capable of taking action outside of the areas where we have jurisdiction to operate.
Thank you. Another question? Please introduce yourself.
My name is Christopher Lemon. I serve as Senior Community Investment Officer at the Arbor Community Foundation. First of all, I want to thank all of you for your time today. I want to thank WHI for putting this on. I think these are the kinds of conversations that we need to be having in real time. We know that this is a complicated situation. I think that anytime because what we're really talking about here is systems level, right? And systems level work, especially when it's been entrenched for years and years and years, takes a lot of time to unpack. And sometimes I think it's complicated for reasons because then it's easier just to keep it going as opposed to making changes that I think are necessary. Part of my concern is that I see this as a call to action, these kinds of gatherings where it's not just about disseminating information, but if we keep hearing that there are gaps in services, if there are gaps in funding, that to me is a call to action. Too often when we are looking for solutions to systems level issues, we wait for a catastrophic event to where, okay, now we're forced to make a change because X number of people passed away, or a certain community is being devastated because of a loss of services. Being in the arena of supporting older adults and caregivers through our funding at the foundation, we can see on the near horizon that the older adult population will double by the year 2040. We already know that nonprofit organizations are at capacity. They're putting Band-Aids over larger wounds that need help. And that too often nonprofits are being forced to design solutions when that's not really the job that they're supposed to be fulfilling. That's not why they were formed. This is only going to get worse. It's not going to get better. And so kicking the can down the road is only hurting those who are currently not being served, and it's making it far worse for those who are on the verge or will age into those situations. So the question for me always comes down to, who is the authority then to spearhead true systems level change and design so that we can bring equity to this particular problem? Now, I'm not saying it's the ATA, but I think that you're probably a part of that conversation. I'm not saying it's Feonix, but you're already a part of the conversation, right? MDOT, you're a part of it, but who else needs to be at the table? But if we all just keep looking at the realities of, well, we can't because, or we can't because of this, there are 1,000 reasons not to really dive into this, but there are a lot more reasons to do it. And each of those reasons has a face to someone who lives in this community. So who takes charge? Who is going to be the entity that spearheads or champions the solutions to these problems? And so I'm not saying that there's an answer, but it's really more of a call to action for those at the table and those in the room, those who are listening. We want to help fund and build those solutions to these systems, But where does the momentum go after this particular meeting? We leave here in a transportation desert. What are we going to do to address it?
Our man, go ahead.
All right, this is where I get just the back.
I saw it go.
Yeah, so excellent points, and thank you. The passion is obvious, and I'm sure that is shared across the room. I'm sure you guys, through this conversation, and through 10 months of work, are really getting a sense of how deep does this rabbit hole go? And it's quite a bit. In terms of the scale at which these systems operate, they need to be regional. To be perfectly blunt, the sheer depth of 130 funding sources, transportation becomes a specialized thing. It's not any of your core businesses. You have core things that you want to do in the community, and transportation is part of it, but you don't want to be a transportation agency that also provides some other services, do you? No. That's why it tends to get hived off and given to an authority or some other operating group that can specialize in that. Right now, there's a bit of a crack, and this issue is falling into the crack. My organization, yes, we're authority, but we're not countywide. I can't operate in that space. We do have a regional body. They're not here today in terms of your question, who else needs to be at the table? You know, that's probably the answer to that question. But because this is a countywide issue, you know, I think it doubles back ultimately, unavoidably to the county government. Because the complexity, specialization, and the scale that is at issue here, and the need for funding, stable, consistent funding, not one-off stuff, really starts to lean towards a government-led service of some sort. Someone said earlier that we all can't take Ubers. Absolutely true. It becomes unaffordable. It's an individual solution. It works for some people, but it's not going to work at a mass scale. So to your point, who else needs to be in the room? I think there are some institutions that could step in, but they will react to the pressure and actions and things they hear from the community. And you know, the Board of Commissioners has already stepped forward to join the RTA. Perhaps that interest can be reignited and sort of checking into, you know, how's it going? What's going on here with the prospects for this going? It might be the people to lead that conversation.
Justin, I believe I just saw a big football being thrown in your direction. You want to comment?
Sure, I'll comment. Yeah, I agree with what you said. That's, you know, why I asked the question earlier that I asked about RTA. And then earlier when the county administrator was here, we were talking about RTA. I have to make an appointment to the RTA soon. And I'm going to be much more deliberate about that now, after the conversation that we had here today.
Thank you very much. Is there another question for one of our panel? Please introduce yourself.
Good morning, my name is Darrell Winslow. I'm the mobility manager at the Ann Arbor VA at the Veterans Hospital. First, I have a couple of apologies to make. So many of you around this room, I have spoken to on the phone for years and have often tried to get out and make a face-to-face meeting. That hasn't happened with many of you. My question is based a little specific for a populace that I'm specifically tasked to assist, and that's our aging veterans. In my position, I'm that mobility navigator that is a unique new term that social workers, nurse care managers, county social workers, outside hospitals, that they call and say, my vet needs. My question is directed specifically towards Ms. Geissler, in that oftentimes when I speak to that veteran or that person and I provide a resource, I hear, I didn't know about that. So as innovations come about, for instance, the ability to locate where is your friend at. On an app, you can see that you put your aging father on a bus in East Lansing and he needs to get to one building 3 blocks down, but suddenly you get a call and he's not there. What does the state plan to do to announce these innovations to make the general populace more comfortable with utilizing public transportation. Falls back on the issue of changing the culture. I personally, both of my parents are deceased, but would have felt very good to put them on a Let's bus if I knew that there was a way I could track they were going from point A to point B and they got there successfully.
Thank you. I'm going to bring the mic up to Janet. Maria, I'm going to come to you next online.
Well, hopefully the MOS platform that we're working on will help people be aware of what's available in their area. Other things that we've done, we got federal funding to do a public marketing campaign, or feds don't like the word marketing. It was a public education campaign to increase awareness about public transit options. This developed marketing tools that all the agencies in the state could use. It included media, spots, billboards, web design things that we made available to all the agencies that they could use to publicize their services. It's really incumbent upon the local transportation providers to get the word out. As part of the MOS application, we are requiring that all the public transit agencies have not just a website, but have a useful website. That's the primary place that so many people go to nowadays to find information about something. They may Google, transportation in Washtenaw County. And then they find People's Express on there and they go to People's Express's website. We want to make sure that all the providers' websites include information, how to get in touch with somebody, what are their routes, what is their service area, what is their fares, all the information that anybody would need to plan a trip or decide if, can this agency help me? And if they can't, Washtenaw County, the Ride and People's Express both get mobility management funding. They should be able to be providing some of these solutions. When somebody calls and says, I want to go from here to there, if their agency isn't the one who can provide that trip, they should have the resources to say, well, this provider can help you out, this agency can help you out, this senior center has a van. So those are some of the things that we're working on to do that.
Thank you, Janet. Marie, is there a online question?
Yeah, our group talked a lot about accessibility and then personal care attendance. So we were wondering for any of the panelists, what personal care attendant programs exist that agencies can use as a model, and then what were the funding opportunities for those programs?
So this is Matt at the Ride. So I mentioned our paratransit A-Ride service, which is targeted specifically for folks with disabilities. Sometimes that includes cognitive impairments. If someone requires a personal care attendant in order to travel, we carry them for free. There's no fair charge on that one. I'm not sure, Robert, do you know offhand if that also counts on the fixed route side of it?
As of right now, yes.
Yeah, so also on the fixed route side. So we're trying to get back to that mainstreaming, trying to get people in on both of those ways. Because as great as the technology ever becomes, and it's improving every year, I have this gut feeling that there's always going to be so many variables involved with helping people with special needs. A personal touch is never going to go away.
Yeah, it is a federal requirement that agencies allow personal care attendants to travel at no additional cost. If it's a trip where you need a ride, like a reservation, such as a paratransit trip, when you book that trip, you have to let them know that you will have a personal care attendant with you. There isn't any kind of restriction about who that person may be. It can be a friend, it can be a family member, it can be a medical care professional. The only restriction is that person must have the same, get on the vehicle with the disabled rider and get off the vehicle at the same time. You can't pick them up along the way, you can't drop them off early, you can't let them ride later. Matt mentioned helping people with cognitive impairments, but really any disability. For example, my elderly parents, my father doesn't have cognitive impairments, but he's hard of hearing. So you don't even need help with the transportation trip. It can be when you go to the end destination. So if my dad is going to the doctor and he wants to be able to hear what the doctor is saying, and he wants me to come along with him to, to hear what the doctor is telling him, I could travel as his personal care attendant because he needs my assistance at his destination.
If I can follow up to clarify that, our group was asking more about agencies providing a personal care attendant for somebody who doesn't have that caregiver to go with them.
Anybody want to comment?
This goes back to the specialization and the handoff. That's where I would have to say, sorry, the transit agency can't do that. That gets a little out of our comfort zone in terms of knowing what an individual's particular needs are. So we specialize on the transportation side of it, but if service agencies are able to provide someone to travel along with someone else, we'll carry them. But we can't get into that space. I'm not even sure from a regulatory perspective how we.
I'll just add a quick comment that in other communities where we work, we have seen, and they're private transportation providers, not public. I've never seen a public transportation provider also provide a care attendant, but I have seen multiple private transportation providers who will have that as an option, who would have you can select that a care attendant go with the passenger, but you pay for that. I mean, again, that transportation already isn't cheap when you're talking door through door services because they have to carry a large insurance. And now you're talking someone else who's responsible for their care while they're in the vehicle. And so, I mean, they have it, but you pay a pretty penny for it.
Thank you. We have one or two more questions here. The dean of it all, Brent.
What did you just do?
Nothing. Didn't do anything.
Okay, so I was hoping to avoid this. Anyway, I'm Brent Williams. I'm the co-chair with Sharon Moore of the Washtenaw Initiative. So first of all, congratulations to everybody who got here. This work has been ongoing for at least years. It's not just 10 months. It's gone back years. In Arbor Community Foundation has been a core source of support for the work that's gone on through WHI. In the last, after 10 months or more, after a careful kind of consortium needs assessment was done, one of the most intelligent things that could be done, the transportation bubbled up. It started out about seniors. What are the needs that our seniors are facing? And transportation bubbled up as maybe the place to go. But taking action has been challenging. So maybe a couple of my thoughts. This is where WHI wants to operate. It's to bring people together who are action oriented, to compare notes and find the low hanging fruit, or find out that it doesn't exist yet, to try to create ways for it to exist. And then to find ways to chip away at the higher hanging fruit as you can. So this is the moment which matters. It's what we take away from here and what happens after this. One comment, we have been able to put in touch the people at the U of M who are gathering that transportation information and doing programming around it, because we know them and we've already put them in touch with Ann Savas. During the meeting, there's been a little email connection, so hopefully I'm cautiously optimistic that that will bear fruit. One of the, so in terms of next steps, some ideas that occurred to me as we're coming out here. The idea of a mobility manager is kind of ubiquitously themed through here. And the investigation of a countywide mobility manager service. So this has happened in aging in general. as you have the services of the 411 around, connecting a single source. It's fraught with hazard because keeping that person or persons updated on the information needed to provide broad-based information around community transportation issues is challenging. But it seems like an idea that's not very expensive. There's a lot of interested players here, from JFS to the county to the ride, who could kind of help fund it. So a little bit of decentralized funding into one centralized source for a mobility manager probably is an idea that strikes me as worth investigating. The rural problems have been front and central as well. And there's a huge they're like systemic structural barriers around. That's why the post office was invented, right? So it's a federally funded way of getting postal services to rural areas, which is a big subsidy from urban to rural areas, and that's why. But it had to be run at the federal level in order to make the funding work. And now it's been around for so long, everybody takes it for granted. That's not really true. People don't take it for granted. But so it's that kind of model and the economics of it that are pretty clearly a challenge. So ideas about how to fund such a thing or create the lowest possible cost. So one idea that came to my mind, there's a large number of volunteer-based services for transportation. And I wonder if there's an opportunity for, friends of mine, routinely drive people around. If there's a way to create a coordinated volunteer-based rural-facing transportation service. And that the next piece is putting pieces in place to make differences down the line. So Commissioner Hodge, your comment, I'm going to be intentional about my appointment to the RTA. That's an important piece of the puzzle that's going to move the needle forward, maybe over the long haul. So those kind of small steps now to create long steps down the line. I think I've taken more than my share of time. I think Dale's moving against me. All right, but thank you.
Yeah, great. I think we're running out of time here, right? So we kind of get to close things up. First of all, for those of you that were described, including this last session, even if you didn't get your point out, if you can please leave it on the table. We're gonna put all that together and somehow produce all these ideas for everyone to consider. If you'd like to be involved in this process further as we go along, please let us know. You know what's the best way to do that? There's a QR code in your folder. Oh, there we go.
There's also a link to all the slides for today on that.
Oh, good. There's a link to everything on there as well. That's great. If you have a specific action step that you can use to take away from this summit, please write that down as well and leave it on the table. Well, I was going to do some closing remarks about action steps, but Chris, you kind of did a great job of that. I thank you for that. So I won't repeat all of that, but we do need to do something. We do need to make progress going forward. A centralized intake process ought to be something that's a high priority in the future, because not only will that solve a lot of the issues that were raised today, it's a way to gather data on the issue and whether we're making progress or not. So I know I'd like to talk about how we can best do that as we go forward. Our system's fragmented, it's not meeting all the needs. There are innovative solutions, and we need to consider how we can improve our system here to be perhaps more centralized and meet complex needs of people. The it's up to us as a community to solve this, and I hope we can all be a part of that discussion. We do need a champion. Right now, we have lots of champions all over every community. Chelsea's got the way, everybody's got champions. But we're not working as well together as we should be or could be. Even the idea of if your agency gets a call about a transportation need and you can't help them, turf it to the next agency and see if they can help them. You know, that was kind of mind-boggling to me and Sue Ann's work that we don't have that. You know, yeah. So I would like to thank everybody for participating. Matt, thanks a lot. And Janet and Marie on the phone. I'm forgetting all of our names here. And Kate. I'm sorry, you listen to her. Kate and of course Sue Ann and her students. And I am gonna make one more shout out to Chris Lemon and the Ann Arbor Community Foundation for making a lot of this possible. I know because of the people you are that every year you always give to nonprofit organizations. But I would encourage you to make a special spot for the Ann Arbor Community Foundation. They do a lot of good and make sure that you help them as well. Did I forget anything?
No, but I do want to just encourage everybody before you leave.
If you hadn't had a chance to look at the posters and maybe now you have some thoughts or questions, please take those sticky notes and put them right on the posters. And I want to thank Dale for being a really great MC for our event.